How to write an operation report. How to write an operation report. Operation reports, that is the record of the operation just performed, it's very important to write this correctly. Medical records obviously are very important, no less so the operation report. It's not only a record for yourself, also for other doctors involved in the care of that patient, and certainly if any problems develop later. Now, first of all, it's usually done by a junior doctor, the surgical assistant. So you may need some assistance or direction from a more senior doctor involved in the operation, or even the consultant or attending. Don't hesitate to ask. You may also look at other operation reports that have been done for similar operations. There'll be a record of those. So write the report as soon as you can after the operation. That is when the patient's been transferred back to the recovery room area and they're settled and stabilized. Otherwise, you're going to forget important details. After all, you haven't been able to keep details during the operation, have you? Now, it used to be in a paper format, but now it's just about always done in a computer. So here you go about doing it. Now, I'm an orthopedic surgeon, so obviously I've got a bias towards that area, but we keep a lot of detail on the actual operational form. So here are the essential elements of an operation report for any operation. So really, obviously, the name of the patient, date of birth, hospital ID, date and time of the operation, name of the surgeon, name of the surgical assistants, name of the anesthesiologist, the diagnosis beforehand, fracture left side, subcapital, post-op. Diagnosis may actually change and may have extended, be a subtrochanteric fracture or abdominal operation. It may have been findings that change the post-op diagnosis. Operation, obviously put down the operation before, fixation fracture left hip using a sliding screw plate system or laparotomy, bowel resection. Then now details, these are very important. You've got to put the details in. Type of anesthetic, general, spinal, regional, agents used, IV antibiotics, name and dosage, tourniquet details, orthopedics, very important. When it was inflated, pressure was inflated too, very important. Just getting back to type of anesthetic, it's very important to have that in actually, because sometimes when they use a regional technique, if there's numbness in the arm or leg afterwards, some people may think there's been damage to a nerve, but it isn't. It's related to prolonged effect of an anesthetic. Tourniquet detail, similar. Tourniquet has been up for more than 4 or 6 hours. There may be some problems related to the tourniquet. It's very important. Positioning on the table is very important in orthopedics. Supine on the side, as well as a position on the table, we need to put down details of traction device. We actually use a traction device for pinning hips. It's a part of the operating table, and it puts traction on the arm, on the say leg, usually just about always on the leg, of course. So you need to have details of that, the type of traction device used. And also, as well as that, you need to put down II, image intensifier used, whether it was or not. Skin and prep type of preparation used, betadine or some other chemical used. Draping details, we find that very important to include. Type of incision, around the hip, anterior, posterior, lateral. Now findings, what you found once you've opened up the patient: subcapital fracture of the hip, fracture of the shaft of the femur, comminuted fracture of the ankle. Implants used, very important during a hip or knee replacement, but name, the type of implant and the sizes. Now when it comes to a hip or knee replacement, this will be quite elaborate. The femoral component for a knee replacement, femoral component, tibial component, spaces. When it comes to plate and screws, you have to do the length of the plate, number of holes, and the screws used. So these are a lot of details and highly relevant. Closure details are important. Closed in layers. And what did you use on the skin? Was staple, absorbable type of technique you used. This will be important for the people who have to take the stitches out. Drain, very important. Was drain put deep? How many drains were used? Was it sutured in place? Post-op instructions, very important. So observations, temperature, pulse, circulation observations, physio details, when you want them ambulated, partial weight bearing, total weight bearing, which side of the bed they can get out on, ICU details. If you want them to go to the ICU, how long to be in there, 12 hours, 24 hours, the ambulation details, weight bearing status, analgesia. Put down the details of the analgesia. This will obviously be a big input from the anesthesiologist. Anticoagulation details, especially important orthopedics. Post-op antibiotics, that's very important orthopedics, probably go for several days, if not a week. When do you want the patient discharged? Same day, one day, several days later. Follow-up when? Seen in a week in the consultant's clinic or an outpatient clinic of some kind. So I hope you find this useful. After the initial few reports you've done, you'll get the routine down and it won't be such a burden for you. But it's important, if you're going to be a surgeon, this is a very important habit and skill to develop early in your career, writing the operative report. Good luck with your career.